Dean Sir, our Dean 2025, Dr. Prasad Sir, to give his address. Prasad Sir.
Good evening, ma'am.
Good evening. You give your address, sir.
Good evening. I congratulate you inaugurating this course AI, which is very useful for our doctor community. But there is apprehension in our doctor community that AI will replace the doctors, or there will be no more doctors in the community if AI is there. But it's not correct. If we go through this AI course, definitely our doctor community will be enlightened the facts of the AI course. See, if we are aware of the AI, we can know that early diagnosis will be the advantage for us, and accurate diagnosis will be that, and patient centered treatment. All patients are not unique, and all patients they don't get same treatment. So AI will decide what treatment will be given to this, because genomic based treatment will be there, and all these things can be decided by the AI. So we should know AI. This is a very beautiful course, and I congratulate CGP for organizing this, inaugurating this course and starting this course. And I wish all the participants to get good knowledge of this, and to apply this knowledge in their practice, and can be benefited. Thank you, Amitabh.
Thank you so much, sir. Now I request Professor Jayalal to give his remarks about this, sir, about this course.
Okay. And thank you, the Honorary Secretary of IMA-CGP, the beloved Dean, the distinguished leaders of Indian Medical Association, College of GP, and the fellow colleagues who have joined the course. I'm extremely delighted and extremely happy to see this birth and the initiation of this course. What we realize throughout the globe, the artificial intelligence or the digital health is going to play a major role. Many often, as rightly said by the Dean, we always have an apprehension, and we always think that among all the profession, medical profession is one, it is very, very slow to adapt to the changes. But the hallmark of any good profession or the good the growth is always our capability to adapt to the new changes and new challenges which are coming in. On that ground, that now artificial intelligence, so it is there for quite a long time. Now it has been in a full-blown thing. It is coming into health. In fact, it has to be called as an augmented intelligence than a pure artificial intelligence. But what is the purpose of this course? And many often there are a lot of like the quackery. There is a lot of things. If you see the website and if you see the thousands of people are now calling for join the AI course, and we are going to teach. And ultimately, they will not be teaching anything, just saying all that their history and something like that they are going on. So what IMA College of General Practice is intended to give the personalized and the hands-on course of the AA. It is not going to be a pure theoretical basis. It should be a course which is able to make the learned audience to comprehend the subject in a full and practically use that AI in their day-to-day work. Starting with the ChatGPT, how to ask for a note or address or the points for writing the something that even a research or the writing for an article, writing for an essay. So all those things we can start with that. It is going on to the extent of agentic AI. Agentic AI, you can even clone yourself, and someone else can talk on behalf of you. All that you can make your own agent without any payment. You can make your secretary, who can see the files, and you can reply to the email. So there's so much of advancements are there, which is always beneficial and in effective way. But understanding that and adopting that is the most important thing. So I'm extremely happy, and when we suggested this in the Governing Council of the IMACGP, the Honorable Secretary was so kind enough to take it and implement it. The credit must be paid to T. N. Ravishankar. He is able to appropriately find the faculty and put that in course. And please utilize this course, and we will be on a constant review of the course, and even if necessary, we will add more of the hands-on training courses into that. And we request all the participants, please give your feedback, because this is what we are just initiating it. So what is our objective is it must benefit you. It is not just for the sake of running a course. And our intention is only that it is need to be a beneficial for us. So you are always free to write back your feedback and what more you want to learn, what kind of lectures you need, and what kind of practical sessions you need. And we are always ready to adopt. So thank you for once again. I thank the team of IMACGP, Dr. Ravishankar, Dr. Amuda, the Dean, and all the joint secretaries for this. And also I wish all the best for the delegates who have joined the course. I wish and hope that definitely it will change your perception on AA and enable you to utilize the AA in your routine day-to-day practice and in your clinical practice and in your academic practice. And it will be empower you to be an AA augmented doctor, which is going to be the beneficial for us. So thank you very much for this opportunity.
Thank you so much, sir, for your vision about AA. Now I request Dr. T. N. Ravishankar to share his views.
President-elect of IMA Tamil Nadu, Ravi Kumar, has joined not only as President-elect but also as a candidate in the AA.
And it is just joined.
So we would request Dr. Ravi Kumar sir to give his words of wisdom for the course. I think he's traveling, but still he will be able to give us some thoughts of his. Dr. Ravi Kumar sir.
Thank you so much, sir. Recognize me.
Good evening, sir.
Good evening, sir. Good evening, sir. It's a very nice initiative that the IMACGP has taken, and hats off to the IMACGP team. And really, I wanted to, though I thought this is the most important one, we have to keep up with the pace of the changes which happens in the healthcare system. So that is the main reason why I joined this. And also as a nursing home practitioner, without AA, future is going to be very difficult. So I thought that this is the right platform where I should join. So though we can go through so many other Google and other platforms where you can know about AA, a structured class is very much important to know certain newer innovations and newer things. So very nice program, sir. We want more people to join and best luck for this first course which has been initiated by IMACGP. Several more courses will come along and we will do wonders. Thank you very much, sir. And thanks to Dr. Ravishankar, sir, for helping Amuda Madam to structure this program.
Thank you, sir. Thank you so much. Dr. Ravishankar, about your opinion.
Yeah, thank you, madam. Thank you, team. Thank you, Taylor sir and Kumar sir, for joining and giving your thoughts. And it was a little difficult to get a faculty initially for the reason that we want to have it to be a very practical one. Dr. Taylor is the one who initiated the whole thing for IMA. Only said that AA should be taken for family physicians. That is how we finally found one person from the medical community, Krishna Rajbhat from Delhi. He is an ENT surgeon and he is there today for an annual conference at Calcutta, and he is on travel. But at the same time, we have another faculty today, an orthopedic surgeon, Dr. Rameshwar Kumar from Bihar. See, IMACGP is the one which is restricted within the state of Tamil Nadu. We want always a pan-India people so that we could stimulate, we could learn from people from all over the country. Ramesh Kumar is one of I think people who are there in the group will know who he is. He's an orthopedic surgeon, particularly specialized in joint replacement, who has done more than 20,000 orthopedic procedures, which includes around 1,000 joint replacements. People of that caliber had found time to learn AI and has now come to the extent of trying to give the thoughts and to teach us on AI. In fact, the course is going to start only at 8:30 because we said we will have to have some time for our leaders to give their thoughts. And at the same time, he is also engaged in another CME and he said he will join exactly at 3:30. AI is absolutely needed. Today, we always think that somebody is our competitor. We don't think when we are thinking our own neighbor practitioner is our competitor. But today, the competition has come from the department in the form of artificial intelligence. I will always say human intelligence is much superior to the artificial intelligence because this human intelligence feeds the artificial intelligence with the data to give us and support us. Without AI today, if you are practicing in your clinic and you find whether this drug can be given along with another drug, or what is the side effect of this drug when you are trying to treat a patient, or you want to interpret a diagnostic tool that you have in your hand, I think AI is always supporting you. When somebody is supporting you, try to maximum possible so that you provide the best of treatment. If you don't learn AI, it's not going to be a problem for you. But if you are not updated in AI, maybe you are bound to lose your practice to the neighbor person who has updated himself with AI. It's going to be a tool for the future, like how a diagnostic tool. 30 years back, it was only clinical medicine. Today, it is evidence-based medicine. Tomorrow, it is going to be artificial intelligence supported medicine. And I thank every one of you having trust in CTP and joined this course to get benefited as the course goes on. With all your feedback, like what Dr. Jailal has said, we will be innovating the course. Please understand, only your feedback can make us and also the faculty to innovate the course so that it will be of immense benefit to you in your practice for your patients. Thank you, Amrita Madam, for the opportunity. We are 8:23, another 7 minutes. We can be sure our faculty, Dr. Ramesh Kumar, will join me. May we get some feedback from some of the candidates who are willing to express their opinion or what they wanted so that we can pass it on to the faculty. Or the Ravichandran.
Sir?
Dr. Ravi, your opinion and your suggestions. What do you expect from this AI? So that we take it forward to the faculty. As an ENT surgeon, the man.
Sir, in ENT, always you can use an AI, sir, because most of the investigations and diagnoses are done with video and other things. So AI can help a lot in future.
Something. Dr. Anuraga, gynecologist. Adam, can you express what you expect from this course?
Sir, I want to know how to advertise. How to, I mean, we are doing a lot of surgeries. How to put it, these surgeries.
prompt questions. You want to know how to put questions into the AI.
Yeah, and then about like we are, I'm going as a faculty for many meetings. Then how to see, we are seeing all the journals, everything, preparing for the meetings along with the cases. When we are doing a voice dictation, we want it to be written. I mean, it has to be written, and then slide making and all the PPT, all that.
Voice to documentation, and you want your PPTs also how to get it done comfortably in the AI. Right, madam?
Yes, sir.
Thank you. We are from which part of the country?
I am from Ambattur, sir.
Ambattur. Okay, madam. Okay.
Ambattur.
Thank you, madam. Thank you, madam. Anybody else?
Sir, Dr. Ravi Kumar here.
Sir, சொல்லுங்க sir. Ravi Kumar sir.
Yes, sir. As a hospital person, AI in monitoring the hospital administration monitoring and where all we have, as you also may be knowing that there are many loopholes where we will be losing many things.
Finance.
So, finance is one, and maintenance of various equipments which we have. We have several equipments, say thousands of equipments. If you just calculate, it will come in hundreds to nearly 1,000. And how to monitor them, how invariably we will be, though we have structured maintenance charts and all, we miss it. Sometimes we even miss taking a license. We miss that is maintaining the equipment, the dates and all. We miss it. So artificial intelligence, how it can help us and do all those things perfectly. So that is one field where we need the help from the artificial intelligence. This class also we expect that how to do that. That is one thing, sir. Second one is I hope they will be sending the recordings and all for us to replay and go through at our leisure time. Because sometimes we may miss the class, or even if we are in the class, we may not be able to concentrate completely. So we want the recordings of the class to be given to the students. I am a student now. I want can be given. So such things, sir.
Yes, sir. I understand that you want it to be used as a alarm tool for you for your hospital administration as well as monitoring system for your hospital's staff and your equipment and all these things. Sir, we intend to put this entire recording in the course of time in our website, probably sending it individually. They might be keep forwarding in a different place, but all we are going to do is put it in the CDP website with people who have joined only to assess it. Otherwise, I think it will become an open forum. And as a past secretary in the state, as HBI, you also know finance is involved in running the show for our association.
Yes. Yes, sir. Yes, sir.
Yes, anybody else?
Yes, sir.
Sir, evening, Dr. Manoj Kumar.
Yes, sir. Yes, sir.
Yeah, from Andhra Pradesh.
Yes, sir.
Actually, problem is now our patients are more intelligent. unless otherwise we learn things, we will be behind them. Because nowadays they are coming, seeing ChatGPT, they are getting all the prescriptions, they are getting all the investigations and asking. Unless we know everything about all this AI, maybe we will be becoming a fool before our patients. I think it's a very, very, very essential before our patients becoming more intelligent than us. So that's why everybody should learn something about AI. Otherwise, we will be very much like a old doctor. Thank you, sir. Thank you.
Thank you. Thank you.
Dr. Sharma, sir.
Dharma sir is there.
சளி திறந்தா மருந்து கொடுத்துருக்கேன். ஃபர்ஸ்ட்டுக்கு சளி தெரியும்.
Dharma sir? India, about your opinion? India? You give your opinion.
Nothing, madam. No. We have to see how it goes.
You have to wait and see.
Yes, ma'am.
Anybody using your chat GPT or AI or your Copilot when you are doing a practice, what for you are using it?
We are using to read only, sir, not for, sometimes when we have doubts, the diagnosis, differential diagnosis, to see, we are using.
So I am using it for to read about some rare disease and rare cases we encounter in practice. Routine cases we know much. In rare cases it helps a lot.
Sure. That is where we are right now using it, but I think we have to use it almost to be doubly confirm on your diagnosis nowadays.
Good evening, sir. I am Dr. Bharat Kumar from Andhra Pradesh.
Yes, sir.
I am using ChatGPT. Being an ophthalmologist, I am not familiar with the ECG reading. My surgical preparation cases are using this ECG report to get the analysis of the ECG before going for surgery. In so many days, I am using the ChatGPT for that purpose only. I want to know what things you can better get from AI. For that, I am joining this course, sir.
I think soon you will not require a physician to give fitness for all your hospitals. AI will definitely come to your support if you feed them with your BP, vitals, your ECG and everything, and they will give you the fitness for the patient to proceed for surgery. So this is what is going to happen.
Really, this is a part of life since 6 months for me, sir. Being a good friend for me also.
Yes. See, this is what is going to happen soon. See, the AI and machine use technology is maximum utilized first by the ophthalmologist and the next by the radiologist. These are two specialties which is using it so often. The next department that on the treatment modality and the coming in for a closer diagnosis quite a number of times. Another group is a pathologist. Pathologists are one who are already using it in a lot because electron microscope, which is going to give you lots of picture with a high pixel, that is going to give an accurate diagnosis. Number of medical cases come to the court from the surgery, pre-surgery, FNAC, post-surgery, non-malignant are going to be doubly sure because AI is going to support the pathologist in a much more stronger way to be damn sure the diagnosis is going to be malignancy or not malignancy. You do a surgery for a non-malignant tumor, that too in a breast when you try to remove the breast and finally land up in the court trying to pay a huge compensation. This things is not going to be there if you are going to utilize AI in a proper way. I think Bharat Kumar sir has given us the scope where the AI is going to be useful in surgical side, particularly when you are trying to get a fitness. Present day, when you are finding it difficult to get a specialist or a cardiologist to get the fitness in an emergency case. Probably in an elective it can be there, but in an elective and an emergency situation, you need somebody to give a support. That support is going to come from artificial intelligence. Anybody else? Srinivasan sir has come.
நான் மியூட்ல வச்சிருக்கேன்.
கொஞ்சம் பேசுறேன்.
அவர்கிட்ட பேசும்போது அவர் லைன்ல தானே பேசுறேன்.
Good evening all. I just wanted to know whether this AI is going to be a very good personal secretary sort of job, because nowadays no one is true to their conscience, sir. Each and every staff, even a senior staff, is cheating. So I feel that one person who will not cheat should be AI, and should be a personalized form of AI. So apart from all those important things which sir has narrated already, I feel that whether this can be a personalized assistant who can schedule things for me and secretary's job.
அதுதான் கேட்டாரு.
நான் பார்த்தேன் இப்பதான் யாரை ஜாயின் பண்ணிட்டாங்க.
Mohideen? He has joined.
Hello? He has joined,
Co-host, yeah. Dr. Ramesh Kumar has joined.
Make me admin.
Yeah.
So that I can share my screen also.
Yes, sir. Mohideen?
Sir, Market, you first.
Yes. Sir, you are made a co-host, sir.
So yes, make me co-host. Yes.
Yes, sir. Done, sir. You can proceed. You are already connected. Thank you. We are seeing you. Thank you for your presence. On a busy schedule, finishing one webinar and coming on to this webinar.
ஜாயின் பண்ணிட்டாரு. அவரோட கோஸ்ட் ஸ்கிரீன் ஓபன் பண்ணுவாரு. எங்கப்பா போச்சு? போயிட்டாரு.
Computer some problem.
அதான்.
Thank you everyone for inviting me, and I think this is the first session of this course. Am I right?
Yes, sir.
And today I am going to give my own story, how I used to come regarding and how I started using artificial intelligence in my day-to-day life, and how it can impact you and your practice in coming days. I just want to give you a overview of all these things. So are you able to see my screen? Everyone
yes,
is ready?
Yes, sir.
Just comment.
Yes, sir.
Just comment me, and I will request everyone not to talk, but better if we will communicate on chat. Are you able to see me?
Yes, sir.
And I will request everyone to have a two-way communication. It will be better, not in the audio visual form, but in the text form. You can ask anything if you want to ask. And I will also request everyone to have communication on chat, so that I will able to see you also, and without any disturbance I will give my whatever deliberation I want to give. Myself, Dr. Rameshwar, I am an orthopedic surgeon based in Bihar. I am associated with one private medical college as a professor and head, and since last 2 years I am having interest in artificial intelligence, and whatever I have learned is learned in this 2 year only. Presently, I am a wing leader of Dr. AI community. It's a global community, you can say, working from India, which is empowering or giving knowledge regarding artificial intelligence to the doctor. I am also the organizing committee member of Global Dr. AI Summit held in 2025 November in Bangalore. I am Perplexity AI fellow, and I have done many courses related to artificial intelligence in last 2 years. I want to start this session with 3 provocating statements. One is given by Elon Musk. All people must be aware about this Elon Musk. He is very great entrepreneur, and he is telling that AI robot will outperform surgeon in 10 years. Are you getting me what I want to tell? That a surgeon being competitive with this robot in coming 10 years, the robot will do better work than any surgeon. Second fact that I want to say is a statement of Bill Gates. Bill Gates is telling that all teachers and doctors are virtually going to be replaced by AI in 20 years. These साल में सारे doctor और teachers को AI will replace. And third fact that I want to share is about China innovation. China has developed a fully AI-run hospital which is treating 14,000 patients per day. These are the facts that I have collected from the different sources. Are you aware of this fact previously? कितने लोग is aware of this fact that Bill Gates has told something like that, Elon Musk has told something like that, and there is some hospital in China which is treating 14,000 patients per day. Is there anybody who is aware out of all these 3 facts that I'm telling? Yes. कहीं ना कहीं से सुना है, रवि जी ने सुना है, रवि कुमार ने सुना है, बासु जी पीपीटी इज नॉट क्लियर. अच्छा, ये पीपीटी थोड़ा सा क्लियर नहीं है, बट नेक्स्ट पीपीटी इज क्लियर.
PPT is clear, but the fonts are all moved. So why the fonts are all
okay?
Probably
but this is the only one slide. I think the next slide you will have this slide is okay.
Right from beginning, all slides are the same.
This slide.
It's also not clear. The fonts are not clear. They are not sharp enough. Probably the signal is not adequate.
Probably it needs any this also.
Yes, sir. Yes, the signal.
Maybe due to signal, because I am able to see it clearly. Agenda of this meeting is what is artificial intelligence. I'm just talking. I think our conversation will be, and this I am going through this presentation also. That is for my own purpose, but you can also see maybe the presentation look may not be as visible as I am able to see. The agenda is what is artificial intelligence, the basic of AI, and I will tell about something like prompting and where you can use as a clinician's AI in teaching, PowerPoint presentation, clinical decision support, hospital management. I will talk about the take-home message. Why AI is to learn AI is must. How many people think that AI is the future? Can you tell me? And how many people think that it is present? If you think it is present, then comment present in your chat box. If you think that it is a future thing, just say future in your comment box. Are you able to listen me? Yes, present. Somebody has, his name is not, IMA CGP has told it is a future. It is a future. Rabi is still it is a future. Doctor, somebody, lot of people has commented that it is a future. But Dr. Guru Hita told that it is a future. See, if whatever I am going to tell you is not future, it's present. I am going to, because that all things I am using it. And AI is like a stethoscope of 21st century. AI will not going to replace doctor, but doctor who know AI is certainly going to replace the doctor who are not knowing AI. AI will save time, reduce error, and increase your impact or increase your it can leverage your skill. And presently it is non-negotiable skill, and it saves time, enhance clarity, and for teaching and learning purposes, it is the best tool because it increases engagement. There are a lot of technological evolutions happens in the evolution of human. In the human revolution or evolution, there are a lot of technological milestone happen. The first technological milestone is supposed to be the discovery of fire and wheels, and the time it happens, it was one of the biggest discovery. Then comes the agriculture. It is also one of the technological revolution. Then industrial revolutions in all these industries come, and since last 20-30 years, the IT technology revolution in which mobile phone came, and that has changed a lot of things. That has replaced a lot of things in front of our eyes. And what people are telling that this is the era of AI, and it will have their impact more bigger and in very short time in coming 5 to 10 years. So we all have to learn this. This is one of the doctors. He is the president of Central Zone of Indian Orthopedic Association. Our senior, Dr. Bhuvan Singh. I have taken his photograph from the net, just net, and see the beauty of AI. I have made this photograph just using the AI, artificial intelligence, and this photograph has been just created by AI, and this changes. Even you can see everything has started by just giving the prompt using the AI. So you can just imagine the power of AI, what it can do. This is the just beginning. And this has not been done by some AI expert, this has been done by me. If people like me can do all these things, to see what are the power of AI. And AI is not new. Actually, the concept, when I started learning AI now, I gone through the literature, even in orthopedics, approximately 20 years back, there are a lot of publications regarding use of artificial intelligence, even in medicine. But the AI has become more relevant after the ChatGPT came. Actually, the biggest problem in present day is the people are being hooked and machine are learning. Machine are continuously learning, and we are hooked in mobile and the smartphones. And our mind is not being developed in such a way, the way machine is learning. And the beauty of this machine learning is this learning does not disappear. Whatever we are learning after our death of our own body, this whole learning used to be finished or vanished. But the learning of machine used to compute, used to evolve, and they do not die. Whatever the knowledge they have, they used to be with there. Or the concept of artificial intelligence is not new. अगर आप देखेंगे ना, whenever we are using YouTube, you will see that if you will see a particular type of things, YouTube started recommending it. Same type of things. If you are having some purchase on Amazon, Amazon used to recommend the same type of product to you. If you are watching something on Facebook, and if you are having some particular interest, some political interest, or some particular belief regarding religions or something like that, you will see that Facebook start promoting similar type of content to you. And this all is due to the artificial intelligence. In the artificial intelligence is not just the things that we used to see in the ChatGPT. Far before the ChatGPT, people are using artificial intelligence, and that intelligence is artificial intelligence is a very broad term. In the intelligence that we used to see in YouTube algorithm, or intelligence we used to see in Amazon purchasing, is machine learning. They used to segregate you in different groups, and based upon that they used to recommend. After this machine learning comes the deep learning, and the concept of deep learning is inspired more by our brain neural network, in which they are connecting the different dots, and based upon this different experience or different dots, they are giving the results. In the deeper part of this deep learning is generative AI. The concept of generative AI is far fascinating. If you are using this ChatGPT, these are all generative. They used to generate. If you ask something, that they will not just copy paste, but they can create something that was based upon their experience. They used to create something. This is generative AI. All these large language models, I will tell you what all these large language models are. They are the part of generative AI. If you will see the evolution of artificial intelligence, it's about 50, 60 years old history. Right in 1950, the artificial concept of artificial intelligence evolved, and they have gone through the different stages, right from the machine learning, deep learning, to the present generative AI, and now, especially in health sector and many sectors, this concept of predictive AI. They can predict, even in healthcare, you can predict that when your kidney will damage, when you will develop diabetes, when the sepsis will develop, far beyond all the laboratory investigations to confirm the sepsis. You can predict this. Then there is also a concept of predictive AI, and that is present. This is not future. A lot of people, even in India, are using all these tools to predict diseases. What I was telling, that the concept of artificial intelligence is not new, but the ChatGPT has exploded its impact to all of us. And when ChatGPT came to market, we all having interest. And even after ChatGPT come, I got interest to know all about this artificial intelligence. But this artificial intelligence was before this ChatGPT also. And in this, all these things, the concept of prompt and prompt engineering is very much essential. How many of you are knowing about this prompting and prompt? Are you knowing about this previously? What is prompt and what is prompt engineering? Yes, no, you can say. Are you able to listen to me? Yes, no. Sir, none of the people are knowing. There are Shruti is telling yes. Dr. AK is telling yes. Dr. Atul is no. Somebody yes. Approximately 30% people are knowing about prompting, and 70% people are not knowing about prompting. Prompting is the way to communicate with the computers. The prompting is a language by which we use to communicate with artificial intelligence. AI is as good as what you are asking. The way you ask, they used to give the reply. The prompting is a science and art of communicating or giving instruction to artificial intelligence. And if you are asking the wrong questions, it will give the wrong reply. And there is there is a scientific way to ask questions to computer or artificial intelligence, and you can simply understand this concept by that artificial intelligence is something like a Einstein sitting in your pocket. But if you will ask the wrong questions, he will not give you the correct answer. You should know what to ask and how to ask. And in this, one thing that I want to give you a message, that AI is a genius in your pocket, but without common sense. You have to give the all context. If you are not giving the all context, it will not give you the full reply. You can go through this. Are you able to see this screen? Are you able to see this screen? If you are able to see this screen, say yes. If you are not able to see this screen properly, say no. Yes. Yes, people are able to see. Yes, good. A lot of people are able to see. It's a story like if some brilliant NEET PG student coming to his professor first time, do not write anything on the screen, otherwise it will be visible like this to everyone. Please just do not write, because somebody is writing it and it will create a mess. Please do not write anything, because you are having a facility to write. Otherwise, we used to just enable this facility, but no problem. If some residents, new PG resident of orthopedics used to come to your department, and professor just tell him, just please go and get some breakfast. What this resident will do? He will go to the some nearby restaurant and take burger or sweet for you, thinking that this is a perfect breakfast for you. But you may be suffering from diabetes. You need you are having some preferences, and because professor has not communicated all these things properly to this resident, and he has given you the wrong. He has not given you the wrong solution. For that resident is not responsible. You should give him the proper context. कि भाई तुमको मैं डायबिटिक आदमी हूँ, तुमको इस रेस्टोरेंट से मुझे मेरे लिए फ्रूट सलाद लेके आना और इस फ्लेवर का लाना है और इस क्वालिटी का लाना है, इस स्टैंडर्ड का लाना है. Are you able to get me what I want to tell you? So you should have this skill to ask this question properly, because it is a genius. This AI is a genius in your pocket, and without common sense, you can't imagine that he must know these things. He know everything, but you have to give the context, and to have a proper questioning. There is something like prompt and prompt engineering, and to write the prompt, greater prompt, you should give a role that you act like this, like you act like a orthopedic surgeon with 25 years of experience. You act like a general physician. You act like a diabetologist. Something like that. So it becomes very specific. Otherwise, it will take data from whatever things that has been written about diabetes. Maybe that has been written by some nurses. That may not be relevant. And in that way, they may give a wrong reply also. You have to specify the task clearly. You have to add details or context. In what format you want the output, you have to also write all these things. And to have these things, there is something like, it is not, talking to this artificial is not like talking to this Google. And there is a concept of good prompt and bad prompt. For that, to have a decent prompt, there is one formula that I used to remember because it is related to medical field. RICE-Q. We use this mnemonic in pain management. Rest, I for ice, C for compression, E for elevation. For any painful condition, we used to give as a first aid this mnemonic we used to use, and the same mnemonic I am using to give a good prompt. You have to R for role. You have to give a role to whatever questions you are asking. You have to give the correct information. You have to give the context. You have to give the example if it's possible, and keep it open-ended. Tell that if you want any other information to have a better answer, ask me question. In the instruction, you can say like that. If as an orthopedic surgeon, if I want to ask what is the treatment for the supracondylar fracture humerus, the better prompt will be act like a expert orthopedic surgeons with 20-year experience, and this is a children of 5 years having displaced supracondylar fractures without neurovascular damage, and I'm working in a primary care setup. What will be the treatment? The same thing will be changed if you are working in the government hospital where CR on all these facilities is there. What should be the treatment? Are you able to understand what I want to tell you about prompting and how you can write the prompt, better prompt? Are you able to understand it? If you are able to understand it, just say yes in your comment box. If you are able to understand what is the prompt, just say yes in your comment box. And I think it's a brief, and this art of communicating to this computer or artificial intelligence is an essential skill for everyone, because no one is going to be, and if you are not able to ask good questions, you will never get the good answer, and you will think that ये तो गड़बड़ करता है, तो गलत reply देता है, तो सही reply नहीं देता है, this is not good, this is not useful. It understand everything what you know, it know far better than you, but you should be able to ask the question properly. And if you are having any problem in writing a good prompt, you can take help of this ChatGPT to write the prompt. You just convey whatever you want to answer and tell him that write a good prompt for me for this problem. It will write a good prompt. You can take help of artificial intelligence for writing a good prompt. And there are a lot of tools, large language models available in the market. How many tools you people are knowing or used? Is there anybody using artificial intelligence, and which tools you are using, and how many tools you are using? Can you somebody tell? Veera Shankara Rao and Satyavati, Dr. Anitha Basu. How many tools? Gamma AI. Gamma AI is good for creating this presentation. It's very good. Very ChatGPT. Somebody is using. Cynthia Martin is using ChatGPT, and Dr. S.K. Ravichandran is using ChatGPT and Gemini. Somebody is not using Meta AI. Somebody is using Meta AI. It's available in WhatsApp. You can use it. Perplexity. IMS CGP is using Perplexity. That's great. That's great. DeepSeek somebody is using. Yes, that's great. Dr. Anita is ChatGPT. A lot of people are using ChatGPT. So there are a lot of large language models. ChatGPT is useful for creating custom GPT. It has even memory. It can write codes also. Perplexity is good for having references because Perplexity also used to hallucinate, but it used to give references. I mean, what term is talking, and it's good for deep research. Gemini is Google integrated because Gemini is already knowledge box, so it's having good. But in internet, a lot of false information is also there. So it has been trained by false information also. So Gemini also used to have wrong information and used to hallucinate. There is a Claude. Claude is a large container. It's safe, responsible, and more ethical. Claude. Grok is Elon Musk guy, and it has been trained by this X. And so it understands the market pulse and social media. It understands better way. So these are a lot of things. There is one free version also from China, and that is DeepSeek. And you can use it in clinical practice also, in clinical decision support. How many people are using AI in their day-to-day clinical decision making? Is there anybody using artificial intelligence in day-to-day clinical practice? Is there anyone who is using artificial intelligence? Can you comment? Yes, let me see. Not it. No, Notebook LLM. That Notebook LLM is also very good. That is good for learning, teaching. It's very good. If you want to learn any topic, because it takes help of this whatever data you used to give, so it does not use to hallucinate. How many people using artificial intelligence for clinical decision support? Tell me some questions that you want to ask to, or any clinical problem that you want to take help from the artificial intelligence. Can you give me some problem statement that you want to solve using artificial intelligence? So that will be better to discuss. Is there anybody who want to have some problem, who want to discuss some problem? Getting heading for giving talk. Getting heading for giving talk. That is also actually, see, this topic can also be solved using artificial intelligence, but this is not related to clinical decision support. I want sepsis issue. This is some Veera Shankara Rao is asking about sepsis issues. Sepsis issues is a very broad term. If you will ask something like what sepsis issues you want to see, asking is when you are typing something now on Google, we used to search like sepsis issue. But when you are talking to artificial intelligence, you will just write, I want to know about sepsis issue. It will not give a very detailed or a precise result. It has to be followed the concept of prompt engineering, the proper You have to give for what? Sepsis in a orthopedics cases, sepsis in a children, newborn baby, sepsis in a pregnant lady or a postpartum lady. What exactly you want? You have to discuss in a very detailed form. First, you have to give the role to the artificial intelligence that act like a expert pediatrician or neonatologist, and having so much experience, and having a newborn baby having this issues. You can even see the put your clinical details कि उसका TLC इतना है, counts इतने हैं, blood culture report, and you can give, and in these references you can ask the questions now, then it will give a accurate reply. And in this way, you can have help in your clinical decision support. Otherwise, in just if you will ask give the management of sepsis, so it will give a very vague report, and sometimes a report in such a format that may be wrong also, because it has been trained with the data that is available on net. And in internet, there are a lot of wrong information already there. If it's taking some wrong information, and based upon that information, if it is giving you output, being a clinician or being a neonatologist or being a pediatrician, you will say, what rubbish this artificial intelligence is giving, and you will say this is not useful things. Can I segregate my clinical data? Can it segregate? Definitely, it can segregate. If you are having data, it can, using this prompt in a proper way, you can segregate this data. Lekin, as a orthopedic surgeon, I am telling my own story, how I used to use this artificial intelligence in my clinical decision support. So, see, if some patients of pain in leg, and this person is about 10-year-old, and there is also swelling over the leg, and on X-ray I am able to see lytic lesion. And I want to take decision what I should take next, because being a routine orthopedic surgeon, treating lot of trauma and fracture cases, we have lost control over this treating this malignancy or tumor. So it's a difficult situation for me, and it's very difficult to go to the book and take the decision. But I know that this I will give the contest, act like a expert orthopedic oncologist. Now it will not take any data from somebody vague person talking about oncology and bone tumor. It will take some relevant data, and after that I will give the context that for this child of 14-year-old having pain and swelling in his right leg since last 15 days, and on in X-ray I am able to see well-defined lytic lesion like this. Even I can attach the X-ray on this. Can you give me the plan of action, what I should do to the next? The other Dr. Yasoda, she is asking, will it give gallbladder disease? Will it give us correctly as a polyp or sludge or calculi? Will it give us correctly? Sometimes it's normal ultrasound scan and it's confusing. No, this will not able to give it to that level. But if you will tell that a lady of about 25-year-old, act like an expert gastroenterologist or gallbladder specialist or a specialist surgeon, tell me that a lady of 25-year or 35-year-old having pain in right hypochondrium, and on X-ray or whatever finding in CT in ultrasound, this is finding is there. Can you tell me? Can it be poly? Can it be sludge? Can it be calculi? And what are the percentage of being false positive or false negative? It will give you all the references, and you can even ask, give me whatever reply you are giving, give me references also for this without hallucination. It will guide you as a clinician, but it cannot. But you can integrate AI in each and every part of your practice, not only in clinical. You can. In history summarization, you can use differential diagnosis, you can use guideline-based recommendations, you can use even in OPD and IPD documentation, you can use if you are having any images. And it's very good in reading the images. Even this general LLMs, there are also specific LLMs, specific images it's very useful, especially in radiology, ophthalmology, derma. It is very useful because it reads image in a far better way than humans. And artificial intelligence is shifting medical practice from evidence-based to personalized healthcare, because everybody is not same. Whatever practice we are doing is till now we are discussing about evidence-based medicines, that this is the evidence of treating this type 2 diabetes in this way, this drug you can use, these are the studies. But now it is being shifted due to artificial intelligence in a personalized healthcare. Because every person is not same. Same paracetamol used to act differently in different people. And how are you able to know this? When you used to monitor a particular person, and then the concept of personalized healthcare, and that is based upon your genomic data and your continuous monitoring, your every vitals is being monitored. And these are the future. This is not being used by me, but this AI in hospital management, creating SOP. I use this creating SOP for all our creating KPI, KRA, job description, SOP checklist. You can do it using artificial intelligence, whatever. Gemini को आप use कर सकते हैं, ChatGPT use कर सकते हैं, staff के summary करने के लिए, emails करने के लिए, email reply करने के लिए, even automate करने के लिए. If you want to have marketing message and plan, you can use in hospitals. AI is very good in teaching, learning, and having presentations. I think learning is never such fun-based and personalized before AI. If you are using AI now, you can learn anything in a more personalized way, because everybody learning capacity is not same. Somebody is good in learning in visual form, somebody is good in learning in audio form, and the learning speed is also different for different people. And if you will start learning anything using AI, now AI used to understand your own learning speed, and I think that is the great thing for creating presentation. Gamma AI you can use, that is very beautiful. Just by giving prompts, you can learn, you can make any slide presentations for any visual or presentations, beautiful presentation. You can use different tools there. You can use AI as a tutor, and for that notebook LLM is very good. Somebody has used notebook in personalized care. I'm using artificial intelligence. How many of you from your friends, relative, or some of your patients used to send 15-page PDF documents of their thyrocare or some other lab investigation, and they will ask you that, please Dr. Saab, can you tell me what is my report? How many people this problem you used to get? And it's very difficult to see all this 15 pages PDF. How many you used to have this problem? So many times, many times. And do you think AI, you can just paste this PDF or whatever in ChatGPT or Gemini and whatever tools, and just ask, this is the report of one of my relative, his name is so and so. If you will not also tell that his name also now, just give me क्योंकि वो 15 पेज का, it's very difficult to read this all 15 pages, 15 pages. It takes a lot of time and lot of energy. अगर आप उस पूरे रिपोर्ट्स को AI will read it, and not only read it, but it will give you a personalized, just give a prompt that just give a advice to my relative in a personalized way on behalf of me, कि what he has to do and what he has not to do. Out of this 15 पेज ना, उसमें दो ही चीज इंपॉर्टेंट रहता है कि उसका विटामिन डी का लेवल बढ़ा हुआ है, यूरिक एसिड बढ़ा हुआ है. उस मरीज को यही चाहिए होता है ना कि देखिए, सी मिस्टर रमेश, माय डियर फ्रेंड, your uric acid is raised and your vitamin D level is raised. Rest all these reports are normal, and you should do this for uric acid, and do this uric acid, and niche on behalf of Dr. Rameshwar. And if you give this, just copy this reply that has been generated by AI and send this on his WhatsApp. He will thank you. And he will see डॉक्टर साहब ने कितना मेरे लिए हेल्प करके मेरा एक रिपोर्ट देखा है और मेरे लिए एक एडवाइस भी दिया और नीचे अपना नाम भी लिखा हुआ. एंड इन दिस वे at present time I using AI to give a personalized care, and lot of times because one of my my own experience, I want to say this, that कि हमारे यहाँ के MP, you must be knowing MP, member of parliament, send this 14-page documents. I'm in PG practice. कि Dr. साहब एक बार report, just go through the report and just advise me. I've given all this thing to the AI, and AI has given a very beautiful personalized reply. See, MP sir, your report is having this problem. You should take care of this. You should take this diet, and you should take this. And thank you for consulting me on behalf of Dr. Rameshwar. And he becomes so pleased that कि डॉक्टर साहब आपने इतना बीजी प्रैक्टिस में मेरे लिए सब कुछ देख के और इतना बड़ा आपने हमारे लिए मैसेज लिख के भेजा, and that all things I have done in 1 minute. So you can use this AI for giving personalized treatment and increasing your impact. अगर इस तरह से आप कितना बार हम चाहते हैं लोगों को हेल्प करना, but due to our own scarcity of time, we are not able to do it. Are you able to understand that? In that way, you can give the personalized. कोई diabetes वाला, there are a lot of people suffering from diabetes, and they used to ask कि क्या खाएं क्या ना खाएं. Just आप AI को बोलो कि this patient, 45-year female having type 2 diabetes. Can you give me a list of the diet that she should take and what she should not take? And her name is Sunita Upadhyay. And give this message on behalf of Dr. Rameshwar Kumar. It will write down everything in such a way that Sunita Devi will see this report now. It will feel like that you have given all these things, taking all this time, you have written all these things on by your own, personally for her, and she become very pleased. Are you able to understand what I am able to tell you? A lot of times we do not used to prescribe physiotherapy only due to the lack of time. And we are not able to give lifestyle modification कि भाई वजन भी कम करिए, weight reduction करिए, daily exercise करिए, नीचे बैठना उठना बचाइए. For our knee pain patients, do regular exercise, eat this things. Only due to the lack of time, but you can leverage artificial intelligence to give this impact. Are you able to understand what I am able to tell you? Are you able to get it? Yes. How to retrieve your own data from your own record? Is there too many? Can install your computer containing data? You can also, a lot of people are getting what I want to tell it, how I am using artificial intelligence in giving personalized care. And this personalized care is just whatever I have told is, it's just a beginning. Based upon your own physical data. आपके शरीर में जो you are wearables, lot of wearable people are, your BP is continuously monitored, your SpO2 is continuously, your pulse is, and rhythm is continuously, and based upon the data of your 1 year, 2 years, it can predict a lot of things and can give you very much personalized care in the future. And this, a lot of startups are working, and these are presently available. A lot of people used to do publication and research. How many of you are really interested to having research and publications? Can anyone tell me? Everybody wants, but we do not able to do it just because it takes time. But artificial intelligence, can you believe me, in the last 1 year, I have got 4 publications and 1 publication in book. And this all I have done using artificial intelligence. And this is not future, this is present, I am doing it. You can use it in anything. Actually, what is the biggest problem now when we are reading any research article? 20 पन्ने का पढ़ते थे तो उतना समय रहता नहीं, और we want to get the trust. Just upload the PDF and you can ask any questions. What are the give me the key points of this research article in 10 words, 10 statements. So you can do a lot of things, literature review, referencing, deep search. You can, if you want to study anything, you can do it at present. I said, hey, this is not future, using artificial intelligence. And I think in this coming courses, you will be able to learn all of things. I'm also a content creator. Actually, I'm having approximately 6.5 lakh followers on different social media platforms, YouTube, Instagram, Facebook. And I use AI in content creation because today having content creation and personal brand is very much essential. How many people feel that having personal brand is very much essential for every doctor? If you feel that it is essential, say yes in your comment box. And I'm using each and every how many years the data are kept in AI. In AI, AI is not like it's like in computer. इतना दिन कंप्यूटर में डाटा रह सकता है उतना दिन तक AI में वो डाटा रखा है. It's never die in artificial. The data does not die in computer. अगर वो हार्ड डिस्क करप्ट हो गया खत्म हो गया तो दूसरी बात है, अदरवाइज इट डज नॉट डाई, इट यूज्ड टू बी हैपन. ये बात दूसरी है कि इट यूज्ड टू लर्न आल्सो. तो इन एवरी स्टेज ऑफ कंटेंट क्रिएशन की क्या टॉपिक पे हमको कंटेंट बनाना है, टॉपिक में क्या हुक होना चाहिए, उसमें कंटेंट क्या होना चाहिए, एवरीथिंग आई यूज टेक अप है. और उसमें पोस्टर बनाने के लिए इवन यू कैन ऑटोमेट द थिंग्स, यू कैन हैव योर ओन क्लोन, you can create images, everything. For script writing you can use ChatGPT, for music you can use Sono, for video you can use Hey and Pictory, for poster or something like Canva AI you can use it. There are a lot of tools which you can use for content creation. You can use your own avatar. कितना लोगों को लगता है कि हम खुद ही नहीं, उसको शर्म आता नहीं बना पाते हैं, so you can create your own avatar. Avatar means it will look like you, it will talk like you, it can clone your voice, it can clone your face, and it will talk on your behalf. And this is not future, this is present. You can do this. Do you want to see my own avatar video? How many people want to see my own avatar video? If you want, I can share you. And this is not future, this is present. You can use in teaching. Teaching, I think the medical teachers are more boring teachers, but you can make this teaching more interesting, more engaging, more fun-based using artificial intelligence, and this is possible for teaching, for presentations. And see, this AI is also language free. If being an orthopedic surgeon, I am in Bihar. If I am talking anything to you in English, if I want to convert in Kannada, Tamil, it is possible using AI. It's not future, it's present. In present, you can do this. And this is the beauty of AI. And there is concept of generative AI versus predictive AI. How many of you are knowing about generative AI and the difference between generative AI and predictive AI? Can you, anybody tell me? Generative AI, what is there in ChatGPT? It used to generate. Predictive AI used to predict. It used to predict the weather, कि अभी कल का मौसम क्या होगा, टेम्परेचर क्या होगा, based upon the previous data. In the same way, it can predict the diseases. कि किसी को सेप्सिस हो रहा है ना, तो सेप्सिस होने के वो नॉर्मली सेप्सिस होगा तो हमारे डाटा से, जिसे हम अपने रिपोर्ट से अगर मिलती वो 24 घंटे बाद पता चलेगा, बट बेस्ड अपॉन द डाटा वी कैन प्रिडिक्ट सेप्सिस 24 आवर्स बिफोर. तो आपको नहीं लगता कि 24 आवर बिफोर इफ यू एबल टू प्रिडिक्ट एनी डिजीजेस, इट कैन क्रिएट अ लॉट ऑफ इम्पैक्ट. इट कैन प्रिडिक्ट द डायबिटीज 1 year before the actual diabetes developed. It can predict CRF, chronic renal failure, before real clinical CRF developed. So it has a lot of impact in clinical, and these tools are already available. Lot of institutions are using it. Apollo है, फिर से वहाँ पे एस्टर हॉस्पिटल है. I gone to one of the conferences, AI conferences in Hyderabad, Esther Hospital. They are using it. So a lot of people are using it, but we have to use AI in a responsible way, because it used to hallucinate. How many people is knowing about hallucinations? Hallucinations in artificial intelligence. Hallucination is giving wrong and false information, because they used to give the result based upon the data they have been trained. And sometimes if you are not able to ask the question properly, it used to give you the wrong reply also. So before giving any comment or taking any help of AI for any clinical decision, double check it also, because it may wrong also. You have to respect the privacy, because whatever data you are giving to the artificial intelligence, this data may not have privacy. Whatever decision is, doctor should always be in the loop, because you are the final person who are responsible for that. So avoid over reliance. And AI is a tool like other tools, like MRI, like CT scan. CT scan में भी false positive, false negative होता है. MRI में भी false positive, false who is responsible if something false positive or something, you are responsible. So you have to understand all these things. AI is also something like that, and you have to understand the concept of hallucination and deepfake. Hallucination is confident wrong output being given by the artificial intelligence. You will learn in these courses. And deepfake is AI generated fake media reports, even discharge summary, even lab reports, even what so-called medical certificates can be, and that will look real. So you should be aware of all these things. Deepfake, you must be knowing about deepfakes in various elections. Modi ji is telling like this, but this is not real. This all AI generated. In similar things, these things can happen in medical, like discharge summary reports or something like that. The future is doctor plus AI. It's never doctor versus AI. You have to understand this, and AI is going to augment doctor, and learning AI is definitely going to help you in the future. It will increase your impact. Coming to this statement from where we started this journey, कि क्या ये 3 statement Elon Musk has told that AI will outperform surgeon in 10 years. Bill Gates is saying that AI will replace doctor in 20 years, and China is telling that 14,000. But this all are not the real picture. Elon Musk and Bill Gates are the investor in all AI. They want that all the people should use AI. AI is not going to replace doctor. अब ये लोग तो धंधा वाले लोग हैं, दे आर एंटरप्रेन्योर सॉर्ट ऑफ थिंग्स, तो इस तरह से क्रिएट करना चाहते हैं. चाइना इनोवेशन जो है ना, कि 14,000 डॉक्टर्स मरीजों का रोज AI हॉस्पिटल में इलाज हो रहा है. These are not real patients. They are virtual patients, virtual doctors, but they are doing all these things. To understand all these things, the picture is maybe look scary, but you have to be aware. And if you are going with AI, and if you are learning AI, then going to be help you. These are all the platforms from where I have learned AI. Dr. AI Community, Dr. AI Global Summit, Indian College of Artificial Intelligence in Medicine, in which I am lifetime member and founder member. Certificate course in artificial intelligence, IIT Delhi. I have learned some courses, and if you are having interest, you can learn from the ChatGPT itself about AI. ChatGPT, I think, is the best thing. You can use Google Studio, or your curiosity that you want to learn AI. That is greater to learn AI. The take-home message out of all this presentation is AI is definitely not the future. It's present, and it boosts your productivity. Smart, small, smart now. Be the doctor of the future. But never think that AI is future. It's present, and develop the AI first mindset. For every problem statement, you can ask. अगर आपके यहाँ ना, you are having some problem with your spouse, you can ask this your problem to AI. It will give you answer. It's like Einstein sitting in your mobile, in your laptop, in your pocket. And you should know how to ask and what to ask and in what way you should ask, and it will give solution to every problem. जो एक कुछ लोग some people are asking कि हमारे पास कंप्यूटर में कितना दिन का डाटा रहता है, how I can use this data. You can ask is all things with AI, and that will give a better reply than me or any other expert in their field for that answer. Are you able to get me or not? If you are able to develop AI first mindset, AI first thinking, it means for every problem you can solve using AI. Then I think the message of communicating with you will be. I think I have communicated the message that I want to communicate with you. And one thing always keep in your mind, that never do everything by AI. Doctors should always be in loop, because AI used to give false information, and whatever false information you are giving, AI is giving on behalf of you. You are responsible. Thank you. Love you all. And if you want to have any questions, you can ask, and you can unmute your this computer or this Zoom, and whatever question you want to ask, you can ask. There are some questions have been asked by someone. Which AI chart do you suggest best in your opinions? It's based upon medical information. I think Perplexity is good because it used to give the reply with references from in that way. But if you are knowing the prompt and prompt engineering, the limitation, the hallucination, if you are able to understand all are good. Something is good for something, something is good for something. Google is good for data, Google-based database. Perplexity is good for references. Grok is good for social media and market pulse understanding. ChatGPT is good for overall things. Claude is good for something more ethical or something like that. I think this is any other question that you want to. All slides are blurred, sir. I am able to understand that the slides are blurred, but sorry, I am not able to help you. I don't able to understand why it is blurred. But it is there. A lot of people are telling. AI for learning anatomy and 3D video for surgeons. Certainly, there are a lot of tools. Actually, last year I had gone to Dubai Health Summit, something like that. And there are a lot of AI tools they have developed. Even for this anatomy, virtual anatomy, you can do using some tools have been developed, and that is based upon this AI. I think. You can use which university is offering now. There is one. This is a private organizations, Dr. AI community, and it is giving in India. It's very low cost courses are giving. You can join it. Even IIT, different IIT, because is giving some courses for artificial intelligence. But just your curiosity to know about artificial intelligence and. If you will ask this ChatGPT as a tutor to learn to teach artificial intelligence for healthcare, it will also because I know a lot of people who are very good in artificial intelligence, especially in health sector. They have not joined any formal courses or any. But they have learned by curiosity using using ChatGPT itself. Will be there the PPT be recorded and sent to yes. If you want, I will share the PPT to you. Yes. Anything else that you want to? All slide are blurred. Yes. Hi sir. How can AI reduce waiting time in patients? There are a lot of tools. There are a lot of tools because it will predict. It can predict based upon the data when people are used, because what you will see now, there are data used to tell everything, and AI used to understand data. How it will understand the data? It will understand the data it will give the data of last 5 years to this AI now. At what time people used to come, at what season, जनवरी में कौन सा किस टाइम पे पेशेंट बढ़ता है, किस टाइम से ये होता है. इवन आफ्टर दैट कि अगर आपके ओपीडी में इतना रस आया ना तो पैथोलॉजी में कितना जाएगा, एंड दैट वे इट कैन प्रिडिक्ट इट and you can prepare your planning manpower in better way. And these tools are being used by many corporate hospitals in a better way. One of the hospital I'm not able to understand its name. I went to the Hyderabad and they are using this to optimize their waiting times for their patients. Thank you, sir. Thank you. I will share the PPT. Thank you. And this session, I was given the responsibility to just ignite the interest to all people regarding artificial intelligence. This is just first class, and I think the subsequent class you will learn more and more and how to use it practically. Thank you all, and it's great talking to you all. Thank you.
Thank you, sir.
Yes,
It was not igniting. It was not igniting. You have created a lot of suspicion, and you have made us expect what is going to come in the next 4 or 5 classes. Thank you, sir. You really ignited us to express us what is going to come, how are we going to learn. And there are so many things sir has provided us, and all these things will be explained or taken now in depth in the subsequent classes. Amuda madam.
Thank you, sir. Thank you so much for the wonderful presentation. We all came to know
Yes, sir.
about the
Thank you,
benefits
sir.
about it
And
also.
Dr. Amuda is the secretary of the College of General Practitioners at IMA headquarters.
I'm also the Vice President.
Vice
Bihar,
President of the Bihar State Unit of IMA.
Oh, okay, Vice President BR okay, sir. Mhm.
Yes, sir. Thank you, sir. Thank you. If you will able to give me some certificate or some letter
Yes.
of giving this letter, that can be useful for me for
Yes,
my
sir.
future thing.
Definitely,
And
sir.
I will
Definitely.
be love to be the part of this organization. And if you will permit me, I will join this session not as a speaker, but as a student, so that I will also learn in this journey.
No, you please continue to join both as a student as well as a faculty. He'll be utilizing your services in sports.
Okay. Thank you, sir. Thank you. Thank you. Good night, sir.
Good night. Good night. Next class next Sunday
Thank you
night.
so much, sir. Thank you all the audience for your patient learning, sharing. We'll meet in the next Sunday. Thank you.
Good night.
Thank you.
Thank you, sir. Thank you all.